Good morning. I've got some questions for MRCOG Part 2. These are quite important questions and they are from various screen top guidelines and TOG articles. So pay attention and try and answer these questions in your own time and then look up the answer. And as I said, these are some of the very important questions that I've come across while revising for MRCOG Part 2. Do like this video and subscribe if you haven't already. Also leave a comment if there's any specific content that you'd like to see. So first question, what is the time decision interval for category 2 cesarean section? Is it 30 minutes, 60 minutes, 90 minutes, 30 to 75 minutes, or 45 to 60 minutes? And the answer is 30 to 75 minutes. Question number 2. What is the most common site of uterine perforation? Anterior uterine wall, posterior uterine wall, fundus, left lateral wall, right lateral wall. And the answer is anterior uterine wall. Question number 3. What is the percentage of patients who go into labor before a planned cesarean section? Is it A, 10%? Is it B, 20%? Is it C, 1%? Is it D, 30%? Is it E, 0.5%? And the answer is A, 10%. Number 4, what is the risk of uterine rupture when there is no scar on the uterus? Is it A, 0.5 to 2 in a 10,000, B, 20 in 20,000, C, 30 in 10,000, D, 40 in 10,000, or E, 10 in 10,000? And the answer is A, 0.5 to 2 in 10,000. What is the recurrence risk of congenital heart block in systemic lupus erythematosus? Is it A, 5%? Is it D? Is it B, 10%? Is it C, 2%? Is it D, 16%? Or is it E, 15%? The answer is D, 16%. When is the exacerbation for asthma most common in pregnancy? Is it A, less than 12 weeks, B, 36 to 40 weeks, C, 12 to 24 weeks, D, 24 to 36 weeks, E, 18 weeks? And the answer is D, 24 to 36 weeks. Number 7, what should women who decline induction of labor after 42 weeks should be offered? Is it A, twice weekly CTG and weekly Dopplers, B, twice weekly CTG and amniotic fluid measurement, C, twice weekly CTG, amniotic fluid measurement and weekly Dopplers, D, twice weekly CTG and weekly Doppler, E, alternate CTG and twice weekly Dopplers? And the answer is twice weekly CTG and amniotic fluid measurement. 8. Fetal fibronectin testing is positive if concentration is above what? Is it A, 200, B, 150, C, 100, D, 50, or E, 250? And the answer is D, 50. Question number 9. What is the success rate of McRoberts maneuver? Is it A, 90%, B, 20%, C, 80%, D, 6%, E, 75%? And the answer is A, 90%. Last question. What is the mortality rate in anaphylaxis? Is it 1 in 1,000? Is it 2 in 10,000? Is it 5 in 1,000? Is it D, 1 in 10,000? Or is it E, 1 in 100,000? And the answer is 1 in 1,000. Well, I hope you found these questions useful. I will continue to update this channel with lots more questions and revision material for MRCOG Part 2. Good luck revising. Don't forget to hit the like button and subscribe to my channel if you haven't already. Also leave any comments down below if there is any specific material that you'd like to watch.